Michelle Crocker, Editorial Director for Windows IT Pro Magazine, and I'm here today with Bob Williamson of SteelEye. We're going to talk a little bit today about the challenges, especially in the medical industry, of keeping data safe. I understand that SteelEye has a product that's specifically focused on that market.
Exactly right. Yes, SteelEye has a product called DataKeeper, and DataKeeper is a data replication solution that lets hospitals make sure that their computerized patient records, electronic medical records, are always available. It's a very major issue, making sure that you can always get access to the data that you need to provide quality of care for your patients. So with the SteelEye DataKeeper product, we make sure that those records are always available to the professionals who need to get access to them.
Right. What are the consequences for a hospital? I mean, I'm sure for every industry it's important to keep data, but it seems in the medical field it would be even more critical.
Absolutely. You know, there are a number of issues that really drive the need for this type of solution. Three of them that are most critical are certainly quality of care. You need to be able to always make sure you have ready access to your patient records as you're making very quick decisions on how to treat those patients. So it becomes imperative that you have readily available access to those records. And certainly today also there are just some new federal regulations that have come down. 2009, for example, the High-Tech Act really provides penalties for hospitals that do not have computerized patient records that are readily available. And so compliance is also a very top-of-mind issue. And then financial. There's a recent study done in the industry that shows that for a 500-bed hospital, 1% downtime per year can cost $1.4 million. Wow. And so you want to make sure that you always have your IT systems fully backed up, protected against any type of disaster that can occur, also from a financial aspect.
Right. I think it's interesting with the compliance issues that you discussed. That really involves more than the IT organization. It's a decision that really is going to be made at the upper levels of the organization as well, because obviously, those are serious matters of compliance. So how does SteelEye address both the corporate business needs and the needs of the IT pro who probably doesn't have a lot of time in the day and really needs this to be done right?
Yeah, it's a great question. Typically what keeps an IT administrator up at night are issues around integrating new technology into their systems. It's the same for any IT administrator. I think healthcare administrators have this increased burden now around compliance with HIPAA and high-tech that they have to worry about as well.
And the High-Tech Act is an extension of HIPAA?
Exactly right, yeah. So in 2009, the High-Tech Act came out, and it really provides an incentive for hospitals to digitize their patient records, but it also provides some penalties in terms of reduced Medicare payments for facilities that do not do that. So we're seeing a big movement in healthcare to take these records, digitize them, put them onto computer systems, but then we have to make sure that they're readily available whenever they're needed for access.
Right, and the healthcare industry, they seem to be a little bit behind maybe some other industries in computerizing in general. So
yeah.
What are some of the ramifications of that for IT pros?
So, several, certainly, as we talked about before, the quality of care is one as well. The major penalties now that the government's going to put upon hospitals that are not fully digitized and don't have ready access to those records is certainly important as well. And you're right that there was, I think, a study done by an analyst firm a couple years back that showed that of all the industries, healthcare was lagging behind in terms of providing availability, moving towards new technology. And it's kind of strange to think about such a critical function in our lives. It's really lagging behind, but it's catching up now. It's a big focus now in the industry.
Right. So tell me a little bit about how the DataKeeper solution works specifically.
Sure. So SteelEye DataKeeper is a data replication product. So if you have your medical records or patient records on a volume, we replicate that volume to another location for you. So if there's a problem in your primary data center and the server holding those records should go down for any reason, by using DataKeeper, you're sure you always have a readily available backup copy of those medical records.
And do most healthcare facilities keep their records on site? Is it like an on-premises storage mechanism typically?
Yeah, most of them do have the primary copy of the records on site. What DataKeeper lets you do is it lets you also build an off-site storage location for those records and have those records replicated in real time from the primary data center to the off-site location.
And tell me a little bit about the failover capabilities. I understand that the product integrates with Microsoft's clustering.
It does, exactly right. So DataKeeper is all about replicating the data, but of course the data is only as good as the application that accesses it.
Right.
So by letting DataKeeper integrate with Microsoft clustering, companies can use Microsoft clustering to protect their SQL Server database, or maybe the application on top of the database that's actually accessing the patient records. Microsoft clustering can do the monitoring of the health of the application in the server, do a failover when required to make sure the application is always available. DataKeeper ensures that the data needed by the application is always at the place where Microsoft is going to move the application to. So it's a really tight integration that gives a very robust solution.
Right. Is there a particular size of healthcare facility that you target with this product?
Yeah, with SteelEye, we're targeting 400 beds and above. Certainly even smaller organizations need this solution, but we think that for a real disaster recovery solution, what we found from our research is that hospitals at 400 beds and above have a driving need now for our solution.
So tell me a little bit about a typical customer. Do you have some stories to share about how healthcare facilities have implemented this solution?
Yeah, absolutely. One of our customers is a medical center in Maryland named Carroll Hospital.
Okay.
They're a 400-bed nonprofit medical center, and they use McKesson's patient folders to hold electronic medical records for patients. Carroll Hospital decided that they needed to build an off-site storage facility for disaster recovery, researched the possible solutions in the industry, and found SteelEye DataKeeper. And we worked with them, and actually in 6 hours had implemented a full disaster recovery solution at Carroll Hospital. And so now they have a disaster recovery site about 2 miles away from the primary data center, has a real-time backup copy of their medical records, and they can switch over to using their disaster recovery site in a couple of minutes.
Right, that's great. And DataKeeper, what version are you on? Is this a new product, or?
Yeah, so great question. So we actually just about several weeks ago released DataKeeper version 7.1.
Oh, okay.
So it's compliant with a Windows Server 2008 R2, the new version of Windows Server that's out. Fully supports SQL Server. It also supports basically any Microsoft application. So
Exchange.
Exactly right. So you can replicate your Exchange data, your SQL Server data. Certainly, here we're focusing hard on the health profession, but really any application data can be replicated by SteelEye DataKeeper.
So any other compliance-driven industries like financial, and they could also benefit from a solution like this.
Absolutely.
Great. What's next with the product? What would you say is on the horizon for new enhancements that you'd be looking for next? I know you just came out with a new version,
Sure.
so you're probably not thinking about the next version yet.
No, well, constantly we're working on optimizing the data transfer speed.
Okay.
So as data volumes grow and grow and grow, you need to make sure you're moving that data faster and faster. So we do a lot of work to optimize the replication of the data.
And probably a speed requirement is probably most intense in the medical field.
Absolutely, yep. We also doing work to support multiple targets, so you can have one data center sending data out to multiple places. That gives you even advanced redundancy for your medical records to make sure that they're always available someplace else. And doing a lot of work as well around supporting new Microsoft technologies that are coming out, integrating with different management consoles from Microsoft. So there's never a shortage of things that we need to do to the product to make it better and better.
Always room for improvement. Well, thanks again. It's really appreciate the time today and learning more about SteelEye's DataKeeper. So
thank you, Michelle.
Thank you.